average day for me would be about an 8 a.m. to 1 p.m. Where we see a catalogue of different patients, ranging from routine appointments to urgent care appointments. And I have a specialist interest in mental health and dermatology.
My typical day-to-day starts by logging on, looking at any blood or pathology results that have come in overnight before starting clinic. My clinic varies from routine and urgent care appointments, and then I also have an interest in dermatology and paediatrics, and we also have a skin afternoon where we focus on skin assessment appointments and then some minor procedures as well.
At Brookside we have formulated patient health teams, or PHTs, which means that we have a great sense of continuity with our patients, and they get to know us and we get to know their conditions and them very well. For example, because I've specialised in mental health, I've done a mental health diploma. This is where it comes in quite useful because you can follow up the patients and make sure that they're progressing well.
I think having a physician associate interest in mental health means that we've got more capacity and more ability for patients to get appointments for mental health needs and conditions, and also to know that they're being supported by someone who's got some specific training in the area, which I think is really helpful. It means also that Tanya is able to feed back things that she's finding from mental health patients, and especially from the SMI patients, and audits and learning, and that's really helpful for us as doctors as we build on that learning. It also means that we've got her role as part of this wider team that we have around mental health, and I guess it overall means that it's just a broader range of things we're looking at.
The PAs really help my work stream in that as we've had more and more working here at the practice, I've been able to focus more on that level of acuity, kind of the low level stuff, which means I need less supervision as well, which means I can see more patients. So that's definitely, from my perspective, that's more beneficial because we can see more patients in the surgery. The PAs are definitely of benefit, and that's why they work well, so that the patients can actually get an appointment and get seen, and we can process that information with the GP supervision to make sure they get routed on the right path. And then ideally still have continuity with that same member of the team as well, if possible, going forward, so they kind of build a bit of relationship, which is helpful.
We have a very multi-team disciplinary sort of approach to our patients, and we all work together. The patients are better suited sometimes going to the PA or to the pharmacist or even the GP, but in the fact that we all work together to make sure the patient gets the best treatment for the problem that they've got, that the PA sort of helps us manage that workload. They're very knowledgeable in what they do, and their clinical history taking is probably along the lines of the paramedics and the nurses, as well as the GP. So it's a full sort of 360 support system for our patients.
I really like being part of the team here. I work alongside doctors, nurses, pharmacists and paramedics, all together to provide patient care. I also really enjoy the continuity of care, getting to know patients, their families and carers, and you really get to build that rapport and see that patient through different aspects of their life.
I'm the lead physician associate from Brookside Group Practice.
I'm a physician associate working in primary care at Brookside Group Practice.